Also today, though, one of the last outstanding items from the now defunct liberal-ndp deal has passed Parliament. Drug coverage for diabetes medications and contraceptions are now law, and the government has to commit to develop a legislative framework for what pharmacare could look like in this country.
And there were many times when we thought this is going to be it. We're not going to be able to move forward with them. And so we fought hard. We did not relent. We continued, and we were able to push Justin Trudeau and the Liberals to achieve this.
This is real progress. But now we need the provinces and territories to come to the table and sign agreements with us that supports Canadians and takes pressure off their household budgets as soon as possible.
We're not going to have a single payer system that bans you and union workers and countless other people from keeping the excellent private plans they already have. And Trudeau and the NDP, frankly, they risk, if you vote for them, you risk losing your drug plan.
All right, so now that the bill has made it all the way through both houses of Parliament, the feds still have to work on these individual deals with the provinces for diabetes and contraceptive coverage. We invited Health Minister Mark Holland on the program today, but he's in Italy for the G7 Health Ministers meeting. So joining us now is the Parliamentary Secretary to the Minister of Health, Yasir Naqvi. Thank you for being here, Mr. Naqvi.
Thank you.
So a very important day, but of course the minister has also said, look, time is ticking here. We have to sign a lot of these deals with the provinces. How much time do you think you need, and can you accomplish this? Because the minister said he wants to get it done by the spring.
Well, first of all, let's acknowledge how historic this moment is to have, for the very first time, a pharmacare legislation into law in Canada. That means 3.5 million Canadians who have diabetes now will be able to get diabetic medication. 9 million women will be able to get contraceptives. So this is a tremendous moment. Now, we know that healthcare is delivered by provinces and territories, and that's why the next step is also critical, which is to sign agreements with the provinces and territories so through their drug plans, these medications could be made available. That work starts in earnest now that Bill C-64 has received a royal assent, is into law, and we will going to be doing that very important work over the next weeks and months to reach those agreements.
Why did the minister say spring of 2025? Are you guys worried about an election?
Well, we want this to be put in place as quickly as possible because Canadians want these medications. These are life-saving medications. It's going to save hundreds of dollars for people who use these medications. So it helps in this affordability crisis as well. And I'll be honest with you, Michael, this is where I have some serious disappointment from the NDP. You know, we worked well together. Both the parties had committed to bringing pharmacare into Canada. We found common ground. We worked together. But what we saw with Jagmeet Singh, his own words, by ripping the agreement, he got rattled by the Conservatives, and now he's playing politics along with Pierre Poilievre, which jeopardizes this important progress. We will keep focused and we'll keep doing the work in making sure that Canadians get the pharmacare.
But he says he still wants to see those deals struck, so it's not like he's walking away from you guys.
Well,
even though he says he tore up the agreement and you no longer have that, he still supports pharmacare. So it's not like he's not supporting you anymore on that front.
Yeah, ball is in his course. We need to make sure that government stays in place, election takes place next October as is scheduled so that we can do this very important work. And not just the rollout of pharmacare with the agreements from provinces and territories, but dental care as well. Dental care has just been open for seniors only, and it's been a smashing success. It's providing seniors with the important dental care they need. We're now, next phase is around youth, and then other Canadians who make $90,000 and uninsured. All that work takes time for its proper implementation. But by playing politics, Jagmeet Singh has shown that he is more interested in the politics of all things as opposed to progress that we as a government are focused on.
So how do you avoid those politics now when dealing with the different provinces and territories? Because we do have already Alberta and Quebec who said, we don't want this deal at all. We want the money for our own programs. What are you going to do to try and negotiate not only with the 11 others, but what do you do about Alberta and Quebec now?
Well, so we have been a government that really believes in collaboration with provinces and territories. We respect their jurisdiction, but we also share with them the motivation to help Canadians. So that's the work that the minister and I and the government are engaged in, is to have those thoughtful conversations, very similar to what we did with childcare, very similar to the work we're doing with the school food program. This is what we are going to engage in now that pharmacare is being passed by House of Commons and Senate.
So does that mean we're going to see 11 different programs? And I say that because we know with the childcare program, it was 13 different deals, and it really is customized to each one of those provinces or territories. So how do you make sure that there is equality across provincial borders to make sure that no matter where you live in this country, you are getting the same type of coverage and that it won't be different deals? Because you're saying it's a fully universal one. Are we going to see 12, 11 or 13 different ones?
Well, so the law says universal pharmacare, and so of course that's our objective. But
it's not universal if you don't have two provinces on board.
But we also know that each province delivers healthcare in their jurisdiction, and that's why those agreements are very, very important. And of course, each province has a different program. As long as we meet the objective that is laid out in the legislation, we're confident that we will cover all Canadians. But let's not undermine the value in engagement, the value in having those thoughtful discussions. And we're already having those conversations with Quebec and Alberta and feel fairly confident that we will be able to reach agreement. But we do need time to get that work. We know that Conservatives don't support this. They have voted, Pierre Poilievre and his Conservative team has voted against this. We know they really don't support public health care to begin with. My disappointment is with Jagmeet Singh and the NDP because they have now taken a side with the Conservatives and have put this important progress online.
I'll push back against you saying that the Conservatives don't support public health care. I think they do support public health care, but Pierre Poilievre today on CP24, one of our sister networks, did say he did warn that the result will be unionized workers will lose their drug coverage because that was negotiated on their behalf and that essentially the public system will replace that one. What do you say to people who are concerned about what Mr. Poilievre
Well, so I think his comments are misguided because the legislation does not require such displacement. In fact, I can also tell you, because I was quite involved in the process in Health Committee, where unions actually came in support of this bill. They actually said that this is exactly what's needed for all Canadians. So we've got support by Canadians, by hardworking people. This is to make sure that there is universal coverage for life-saving medications when it comes to diabetes and contraceptives. That's going to help Canadians not only to live healthy lives, but also save them money.
But what do you say to Canadians that are worried that their plan sponsors or their employers are now going to pull back or pare back what they will cover because they are seeing a federal system come, and that there could be gaps here because we know that some of the diabetics medications or diabetes medications that may be covered under the federal system may be specialized for some people and they were being covered under their own private system, but that the private system might pare back that coverage now as a result of the federal system. How do you make sure that there aren't those gaps?
Well, again, I think that's a decision of those private healthcare providers because the legislation does not say this.
But it affects people.
Our aim is to make sure that Canadians who need diabetes medications or contraceptives get those medications available to them in all provinces and territories. Implementation is always very important once you pass a law, and that is the work that we are now starting in earnest to ensure that Canadians have the advantage of a publicly funded pharmacare system, just like our healthcare system.
And all of the drugs under diabetes and contraception, do you want will all of them be covered? Again, the specialized one that people are having covered under their own private plans, will those also be covered?
There's a process that's outlined in the legislation through the Canada Drug Agency that's going to be developing a formulary that will then outline exactly what kind of medications.
Minister Holland had said that the diabetes medications and contraceptives are just the first step, basically calling it a pilot project. How much of a timeline do you have on making this fully universal and making sure that there is full universality for a pharmacare program in this country?
So that's a very good question. So we actually contemplate in the legislation that has been passed into law. As a result of this legislation, now there will be an expert panel that will be created, and their job is to report back in a year both looking at the policy that has been put in place to ensure that it's the right policy. If there are gaps, that they will identify those gaps, but also next steps. We want to make these important healthcare decisions based on the expert advice we receive. I think Canadians expect that of us, that politicians are not the ones making their healthcare decisions. Of course, we need to make sure that the right set of policies are there, the funding is there, but as to what's covered and how, that should be made by experts. This legislation now kicks off that process also at the same time, so that 1 year from now, we will have guidance as to what those next steps look like.
Can you appreciate Canadians who might sit back and look at this? And I know you started by saying we need to celebrate this day, but some may look at this and say, this isn't really a pharmacare program. It's covering contraceptives and drugs for diabetes. It's basically, still very narrow. What do you say to those people who look at this and go, well, this still isn't good enough?
Well, I hear them, but I think this is a very important step. I've served at the provincial level in Ontario when we brought OHIP Plus to cover, and again, it was the Conservatives under Doug Ford who, when they came in power, got rid of that universal program. I'm very excited that at the federal level, that for the very first time, we have a framework legislation dealing with pharmacare. Part of that framework legislation is starting with 2 sets of medications, important medications around diabetes and contraceptives, and fully recognize that there's more work to be done. So I'm thrilled that we have taken this important, important first step. There's more work to be done, and that's why we need the time to get that work done.
Okay, we're going to have to leave it there. The Parliamentary Secretary to the Minister of Health, Yasir Naqvi, thank you so much for being with us. I appreciate it.
Thank you, and happy Thanksgiving to you and your family.
Thank you to you as well.